Hello, guys. How are you? It's been a while. This is me, Hans, again from ReproMed. I'm the medical director. I just wanted to have a little chat with you again for a few things that have changed these last days. I'm very happy to tell everybody that we are fully open and working back. The reason we're doing that is because, well, we have a lot more data now. There has been, we know that some cases in pregnancy where babies have been born preterm, although that data is still inconclusive whether these few cases were because of that COVID-19 infection in the mothers. We've also seen that there has been some babies that have been diagnosed with COVID-19, but we're still not sure whether that was transferred to the babies during the pregnancy or at the time of birth. Now, all these kids have just suffered very mild forms of COVID-19, if or totally asymptomatic. So that's also something reassuring. Um, Now, not only that, all fertility societies, thanks to this, have are in agreement that clinics should be open, that clinics should be working. There is no recommendation for patients not to get pregnant in the general population or the infertile population. Thank God. Now, yes, as I said, we are open again. We're working fully for all types of treatments, but we have to do them in accordance to the recommendations of our health institutions. So we need to maintain social distancing as much as we can, and we are definitely recommending the use of masks. Okay, so all our patients will be wearing masks. These masks can be either clinical masks or cloth masks. During our procedures, yes, they will have to be clinical masks. All our personnel is maintaining social distancing as much as we can, of course, and keeping everybody during all day with masks also. Now, this has also brought certain changes. We are now not doing on-site consultations. All consultations are via Zoom. This is a paradigm that we have broken, and I'm very, very happy we did, because we are seeing that the majority of our patients that have been receiving Zoom consultations are either as happy or happier than they were with on-site consultations. There is less driving, there is less wasting time. I know a lot of our patients come from other parts of Ireland, so one on-site consultation could mean a 4-hour waste for these patients. This is completely over. We are using audiovisuals. We are very experienced. The majority of our doctors have worked in clinics in Spain where online consultations were already being used for the past few years. So we're very, very used to doing these. And yes, the feedback has been great. Essentially, guys, the waiting time for now is very mild. Definitely, we are maybe not moving as many numbers as we used to, just to try to keep things on time and try to keep things with social distancing as much as we can. But we are definitely open for every type of treatment. The waiting time, as I said, is not very big. So if you were waiting for news, if you were waiting for changes, they are already in place, and please get in touch. Okay, things are working really well. Our results are still as good as they were before COVID-19, so we're very, very happy with the reopening. I do not expect there being another close down, unless of course the government tells us. But as a medical facility, with the knowledge we have now on how this virus behaves and how we can handle certain risk factors, I don't think we'll be closing again. I think we're here to stay. So I'm very happy to tell you that. Have a beautiful day, and I hopefully see you soon.